Anthem hospitals. I'm Dr. Ann Borik, board certified at internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to DocTalk Radio, live, sponsored by Gilbert Hospital and Florence Hospital at Anthem. We have a really great show in store today. The studio is full. We have the flight crew in the studio. Guys, thank you so much for coming.
Yeah, great to be here.
You know, for me, it's exciting because I've always wanted to talk to the flight crew and find out really what happens, with our patients that are transferred, out of the hospital for emergency situations and so forth. So those of you listening, this is a great opportunity. If you have questions, join in the conversation, 480-745-1033. We're going to go around the table and just kind of introduce, our group today, and then we'll, get into the conversation. I want to start with Sandy Nygaard. Sandy, welcome.
Hi, thank you.
You're a paramedic coordinator at Gilbert Hospital and Florence Hospital at Anthem.
That is correct, yes.
Great. And next we have Vanessa Bowmaster, the flight medic.
Yep, that's right.
Okay, and Jennifer Laughlin, the flight nurse.
Yes.
Great. Well, and we also have at the table that you probably can't see right now, but we're going to hopefully adjust here, Kyle Krebs, who's the business development for this LifeNet group, which is what we're going to be talking about here in a minute. Sandy, tell us a little bit about your role at the hospital. I see you every day. You're a great resource for us. I know that you work very hard in educational processes and so forth. Tell us a little bit about that.
Yes, well, when Gilbert Hospital decided to become an ALS base, which is Advanced Life Support Base Station, which means that we offer medical direction for some of the paramedics across the valley, and we do in the Florence Fire Department is based with us, Rural Metro, Southwest Ambulance. I have Queen Valley Fire.
Wow.
And I also have Pinal County Sheriff's Office Search and Rescue. So we have kind of a pretty big group there that I kind of oversee and look after, which is sometimes a challenge. But
that's great because it really is more community-based. Is that right? I mean,
yes, very much community-based. And a lot of these people I have worked with for many years, so it really does bring it all together. Mm-hmm. So, and what else do I do? Well, we educate. We do a lot of education because that's really what it's all about, is keeping up with what's going on, all the latest things that are going on.
Absolutely.
New changes. So we keep quite busy. I keep quite busy.
Yeah, you really do. You've been teaching classes for a long time.
Oh, yes,
right?
Many years, mm-hmm. Yes.
That's great.
So I taught emergency medical technology, and we are going to be putting on a paramedic recertification program at the Florence Hospital, which will be a first for us. Wow. So we're pretty excited about that.
You're really an asset to the hospital. I mean, it's great to have somebody like you as a resource for a hospital like Gilbert ER, Florence Hospital at Anthem. So thank you so much for, being there, and you really were instrumental in helping to get these guys here on the show. So, again,
it's all that community partnership. We're all about togetherness and community partnership, whatever's best for our community.
That's neat. Vanessa, tell us a little bit about your background.
I was born in the Midwest, and I graduated from Creighton University with a degree in EMS. Mm-hmm. And I worked as a ground paramedic for a few years and kind of got more into the critical care aspect and got a flight job about a year and a half ago. I originally flew in Iowa.
Wow.
And then transferred out here about 6 months ago or so, and I've been working with Jen ever since.
That's neat. So do you guys have a fixed group that you work with all the time?
Yeah.
So that makes a difference.
Yeah, mm-hmm. Always a nurse and usually a paramedic partner, mm-hmm. and we work together. And
how do you like Arizona?
I love it.
Do you really?
It's so beautiful, so different.
It is, especially this time of the year.
Yes.
Yeah. Wow. And LifeNet is under Air Methods, is what I understand. Is that right?
Right.
And it's a huge organization. It's probably one of the largest worldwide in terms of air medics and so forth. Is that right?
Yes, that is right. Mm-hmm. We service 47 states. There's 24 bases here in Arizona.
Wow.
We have mostly helicopters, but about 3 fixed-wing airplanes that can go longer distances.
That's awesome. That's really great. So you are the paramedic on the flight when we send our patients out.
That's right.
Wow. And Jen, you're an RN, is that right? Tell us
correct.
A little bit about your background and training and so forth.
I actually went to school here in the community, from elementary school all the way up through college.
So you're a native?
Almost. Close enough.
Okay. Uh-huh. Mm-hmm.
I've worked in several of the ERs. I have 13 years of emergency medicine experience.
Great.
And about 2.5 years ago, I started working for LifeNet.
Wow.
I've been here ever since.
And I get that you really love doing what you do. I mean, it's totally different than being a floor nurse or an ER nurse or an ICU nurse. Like, what would a normal day look like? If you can kind of walk through, maybe the both of you can kind of chime in and just give us a snapshot of what your day looks like.
Well, we come into work and we get report from the off-coming crew.
Mm-hmm.
We do basic things like narcotic counts and stuff like that.
Mm-hmm.
We make sure that all of our paperwork is up to date. We go out to the aircraft and we check all of our equipment, all of our vents, all of our IV pumps, make sure that all of our equipment is
every day
and working every day, every shift.
Wow.
Does it.
Mm-hmm.
And then, we're on call for our 24-hour shifts. So we do a lot of standbys where ambulance crews or fire crews will call us and say we might need you. So, we get ready and we go up to the aircraft and make sure we have all of our stuff and wait for our call.
Wow, that's exciting. So it's kind of like an adrenaline rush.
Yes.
Is it? I mean, would you say that? Yeah. Could anybody do that? I mean, or is there additional training or certifications? What, tell us a little bit about, I mean, if somebody were listening and, has their RN and maybe is interested in becoming a flight nurse, what process, educational-wise, would they have to go through? As
for nursing, you have to have several years of experience. I know Air Methods likes you to have 4 years of either of critical care experience, which is ER or ICU. And then there's several advanced certs that they require you to have, specialized trauma certs, of course your ACLS. We take care of anybody from neonatal patients, OB patients, all the way up to however old.
Right.
So you have to be able to take care of all those patients.
That's amazing. So as a medic, what does the medic do, in this, on the flight?
The nurse and I really work together as a partnership. One of the things that LifeNet stresses is it's always 50-50.
Okay.
Right? Or as close as we can get.
Mm-hmm.
So as a paramedic, if you're interested in becoming a flight medic, Air Methods likes 3 years of experience, the company we work for. But really what helps a lot is staying dedicated to education and learning about critical care and going above and beyond kind of the normal paramedic stuff.
Mm-hmm.
And then getting out there and getting your resume out and getting hired on. Right. And you get a lot of on-the-job experience, too.
I can imagine. Now, there's a whole other, aviation part of this whole thing.
Right.
Tell us a little bit about that. I mean, in terms of the pilot, is the pilot medically based, or how who's the rest of the team?
We have 4 pilots usually at a base. And the pilots can switch as long as it's the same kind of aircraft. They can work at different bases. But they do a 12-hour shift, and we do a 24-hour shift, so we get to see 2 of them a day.
Okay.
And they operate under the FAA guidelines, and the FAA keeps them, checks on them and makes sure they have everything up to date and ready to go. And then they are not medically trained at all, but they sure work with us and help any way they can.
And it's good to have somebody dedicated doing their job, because you want to rely on, safety. I guess safety comes first. Is that right?
Yeah, we also have a mechanic that comes in several times a week and works on our aircraft and makes sure that everything is safe for us.
Wow. Does the mechanic fly with you or no?
He does not fly with us, no, but he will go up with the pilot and do test flights and stuff like that.
Wow. We have a question. This is good. Joe.
Brenda from Phoenix would like to know how many people are in the helicopter, including the pilot, not the patients. And then one more question from her. Can you take more than one injured person at a time?
Our crew consists of a pilot, a registered nurse, and usually a paramedic. So we have a crew of 3 in the aircraft at all times, and we can only take 1 injured person at a time.
Gotcha. We have one other question from Colorado Springs, Colorado. Jackson. He would like to know what kind of helicopters does your team fly in?
We fly an A-Star or an AS-350. It's a single-engine aircraft. There's about enough room for, we can get 5 people in there if we have to. We do some prisoner flights, and so we'll take a guard with us, so there will be that extra person in there from time to time.
Interesting. That's good. Good questions. remember, people calling in 480-745-1033. This is really a unique opportunity to have the flight crew, to ask whatever questions that that may come up.
We do have one more from a chatter out there.
Mm-hmm.
If a superstorm like Sandy would occur, God forbid, in our area, is your team committed to help out? Is it voluntary, or can the authorities command your services?
Good question. Yeah.
We have a team set up and special training through Air Methods that gives us the resources we need to respond to something like the storm. We send crews out there to help, but here at home it is kind of a voluntary thing, and I know I can speak for myself. I guess I would come in and help in a heartbeat, just kind of what we do.
Right.
So
Yeah, the aircrafts in the area would definitely help out, and then Air Methods also sends in additional aircrafts if needed.
Mm-hmm. And we were talking before the show, about in New York, I guess, because Air Methods is one of the biggest. As we speak today in New York City, there are flight crews ministering there. Is that right?
That's right.
That are mobilized,
That's
I
correct.
guess.
Yep.
Yeah, that's really great. Now, the quarters where you stay when you're on call, you have to stay at the hospital or you have to stay somewhere close by. Is that right?
Yeah, we are stationed at Florence Hospital. We're up on the second floor, and we have to stay there. We can't leave our base.
And the same at Gilbert as well?
Yes.
That's really interesting because, I've been working there now for, 6 years or whatever, and I've never really been up to the quarters. So I have to take a tour and come up and see what's going on up there. But you can't leave. That's where you're stationed, so that if something comes up, you're called to come out.
Yep.
Okay. Wow, that's really good. Was there another question there or comment? Okay. Community outreach. I know that, we were talking a little bit about that. What's the difference? There are some flight crews that work in the hospital, and then there are some that don't. Can you give us a little information about defining that? I think we were talking about you're community-based.
We are a community-based aircraft. The difference between community and hospital-based is the hospital-based aircrafts are the paramedics and nurses are employed by the hospital,
okay,
and we supply them with the aircraft and the pilot.
Mm-hmm.
With us being community-based, we are LifeNet employees.
I see. Okay, and you basically come and set up shop there.
Correct.
Yeah.
We have a program up north called Guardian, and they are hospital-based.
Okay. That's interesting. I know there's a question. There's some certifications. I want you to go through some of the certifications that you have that your normal ICU, RN, or floor nurse or paramedic wouldn't have. Can we? I really want to get how highly trained you guys are to do this, and I want our listeners to get that, because I think we talk about the cream of the crop, and I think that's who you guys are. Really. Doing this in flight, so that's really good. If you can give us some.
Well, our certs start out with NRP, which is neonatal resuscitation, and all the PALS, which is pediatrics, ACLS, which is adults. We have to have a trauma cert, which is usually PHTLS, and then we have our flight certifications.
When you say flight certifications, what is that?
CFRN, certified flight.
Okay.
And then paramedics also have a specialized flight.
Yeah, so there are critical care courses that paramedics can take, and they can range from a couple weeks to a full semester of courses. And after you take those, you can take this big critical care examination that is incredibly difficult test. And our company requires nurses to have it within 2 years, and they're going that direction for paramedics. And so it teaches you everything that you need to know about taking care of an ICU level patient.
Excellent.
And taking them outside of a hospital, because we are in a small aircraft and we don't really have a doctor there to help us out. We can always call if we need to, but.
So you do have access, or like a lifeline, if you will. Now, do you normally, let's say you picked up a patient that's being transferred to another hospital. Is your lifeline physician where you left or where you're going to? I mean, you know what I'm saying? Or do you have somebody that's on staff that is your own specific physician that is your medical director, for example?
It's kind of both. You know, we definitely work with the sending physician. We definitely work with the receiving physician. And, of course, if we do have a problem in flight, if we have no access to either one of those, we do have medical directors. We have several medical directors that we are able to contact.
Okay, that's huge. That's great. There's the certification of just in the air, being an air medic. So not only are you scrutinized under the medical licensure or license, but it's also the aeronautic or the aviation as well. So it's kind of a dual certification, if you will. Is that right?
Yeah, you're working for kind of two, or you're putting together two services that are very, very highly regulated, like you said, the FAA and in the medical field. And both of those come into play in everything that we do. And so we really have to be aware of the aircraft that we're in, aware of flight safety, and take care of a patient at the same time.
What is your service area in the area? What is the range, or who all do you?
Well, we mainly service Florence, Coolidge, and Santan area, but we do get called out to go to like San Carlos, White River, Upper Valley. There's several surrounding areas that we do get called out for. Sometimes there is an accident, a motor vehicle accident, where they need several aircraft. So, you know, we could actually be called out pretty much anywhere.
At any time, anywhere.
Yep.
Wow.
All right, we have Peg Lindstrom from Hartford, Connecticut. Does it scare you being attractive young ladies to serve the prisoners who just want to escape, or do you not cater to maximum security?
We do cater to every prisoner. If they are sick, we are going to transport them, and we do have special safety measures that we are required to take when transporting a prisoner. So I've never felt uncomfortable taking a prisoner, just because, safety is our first thing, and Air Methods make sure that we're safe every time.
Fantastic.
And oftentimes they're accompanied by a guard.
Right.
Is that right?
Always.
You would never
They're
take
always
them
accompanied by a guard.
Mm-hmm. And that's policy, I guess.
Yes.
Yeah. Wow. That's great. What else do you have any personal stories that you want to share? I'd love to just kind of hear, not specifics, you don't have to give names, but does any specific case in your training experience, come to mind to share? Because it's always neat to hear examples. Anything come to mind?
I think, and I think you were with me on it, Jen, one of the very first flights I did here in Arizona, and it was quite a change coming from Iowa, where there was one helicopter and a whole lot of people and a whole lot of land we were covering, to a more densely populated area like Phoenix. Mm-hmm. One of my first flights was a flight where we went in with 4 helicopters to one accident. And one of the other things that kind of complicated it was dark out, so we had to land with night vision goggles. And there was a crop duster airplane flying almost over the scene where we were. And so just to hear the pilots kind of coordinate that whole landing and scene, and with the crop duster and all the aircraft in one spot, was amazing.
That's amazing. Do you ever feel unsafe? I mean, have you ever felt like your life was at risk or anything?
I haven't felt unsafe. There's a certain amount of adrenaline, like you said before. Mm-hmm. You're getting in an aircraft and you're going to do something that's not really an everyday run-of-the-mill thing. And our company has taken many, many steps to keep us safe. We have very advanced safety equipment, navigation equipment. Our pilots are highly trained. So I've never felt in danger at all, but there's always that adrenaline every time you go out.
Right.
Yeah, and we have this saying with our crews, it's always 3 to go and 1 to say no. So if there's one person that does not feel comfortable with a flight, then we can always divert it to somebody else.
That's good. That's good to know. So that if there's an uneasy feeling, or you just, they have an opportunity to kind of step out of it and bring somebody else in.
Right.
Do physicians ever fly with you? I mean, do you ever, have an ER doc accompany you, or is that ever part of a flight, or a medical director, or is that just out of the jurisdiction of the medical physician?
They would be considered a ride-along unless it's one of our medical directors, which I've never had them ride along with us, but that's definitely a possibility.
Okay, so it's not like I'm not saying to do it just because it's kind of fun to do, but I'm saying as a, is there any specific case where a patient's condition requires a physician to be on with you or not?
No. I mean, we're so highly trained, and having an RN on the flight along with a paramedic, we're able to transport.
I think would probably just get in your way, actually.
Any patient.
Isn't that true? I mean, exactly. That's exactly probably what would happen. That's good. You have a question, Jay?
We got a couple out here. One off the chat says, seems like military personnel would be a great fit for this kind of crew. Do you have many former military people on your team?
We do, actually. A lot of our pilots are military trained. We have one medic at our base who is ex-military. We get a lot of military trained personnel in our field of work.
How about nurses, even just the medics and nursing as well, right?
Yes.
Mm-hmm. Good.
And then we had Beverly out of Tucson says, are your teams mostly all female? And where do we fill out an application or send a resume?
We are mixed, equal male, female, just depends on who happens to be right for that position. And you can go to airmethods.com and fill out a resume.
That's good, airmethods.com. And that's one of the largest worldwide aviation medic companies in the world, basically.
We are the largest air medical transport company.
Wow, that's amazing. I want to get to Kyle here in a minute, so if we can kind of switch gears there, I'm going to kind of let you guys do that, and we'll continue our conversation here. Do you have volunteers at all? Like let's say somebody is interested in being a flight nurse or a medic, and they really haven't experienced it. Do you welcome like RNs to fly with you or ride with you, just to kind of give them a taste of what it's like? Is that possible to do?
Absolutely, yeah. As I think you have to be in the medical field, whether it be an RN, a paramedic, if you're going to nursing school, anything like that. We do take ride-alongs with us, depending on weather, weight balances, all that good stuff.
Sure.
And I think a good first step, if you're interested, is to come out and meet the flight crew and see the helicopter. If we're stationed at Florence, there's another helicopter at Gilbert. We're always more than happy to show people our office.
Mm-hmm. That's neat. And your office is really the helicopter.
Yeah.
I mean, how cool is that? I mean, that's really, really neat. Kyle, welcome. Welcome to the conversation.
Thank you.
I want to hear from you a little bit about when you say business development. Tell us a little bit about what your job is and what you do.
Well, I have a great job, and I really enjoy going out to the bases. I'm the Southern Regional Manager for Southern Arizona, so there are 7 bases that I'm responsible for.
Wow.
And that includes a lot of PR, so setting up events, whether it's a festival, a fair, you may see a booth or our aircraft there. I coordinate that with the facility and then with the flight crew to make sure that we have everything that they need in order for them to be successful.
Now, who would your primary customer be? Like if you were, you know what I'm saying? It's not necessarily the general. Was it different hospitals or different?
So the other part of my job is to go to the hospitals, visit the fire departments, EMS, and let them know what services we have to offer, and then also find out what their needs are and how we as an air medical provider can then service those needs.
I see. Is there, again, we were talking a little earlier about insurance. Is this covered? Is this a health benefit that's covered by most insurances? Let's say somebody came in, needed to be transferred to the cardiac cath lab emergently. Is that covered by the insurance?
Well, everybody's insurance is a little bit different and unique. And so a lot of the insurance companies have a set rate that they're going to reimburse the air medical provider. We have a program that's called Omni Advantage. And what that program does is if you've got medical insurance and the insurance provider that you're with covers only a certain portion of that cost, and you have that insurance, and that insurance is very inexpensive. It's $50 a year. And what we'll do is, with your insurance reimbursement, we will then, if you have our membership program, you're a part of that, we will then write off the rest of the remaining expense that claim, warrants.
Wow.
So it could save you literally thousands of dollars.
Right. So I guess people listening, it's something that they should check with their insurance company, or how?
Well, what they can do is they can find out more information on our website.
Okay.
You can go there. The other thing is you can fill out an application, submit that application, and then we'll review each case by case basis based on the type of insurance that you provide, and then we'll coordinate that with you and your insurance company to make sure that we provide that service and make sure that you fit that criteria.
Right. And I mean, this is really not, I don't want to say an option, but it's usually an emergency situation, so that kind of puts you in a situation where you want to be prepared in case something happens.
Correct.
Right? Yeah, that's good. We were talking about just a few shows ago about if a patient comes into Gilbert Hospital, we don't have a cardiac cath lab there, and that patient needs to be transferred. Let's say they're coming in with an acute myocardial infarction. Time is muscle. We want to get them to the cath lab, get that artery opened up. Would you folks be the people that would transfer that patient, across the valley, up the street to the cath lab?
Right. Yes, we would.
Okay.
And our company sets kind of goals for all of us. And one of those goals is if we do get a patient that's having a heart attack, we should only be with that patient at the sending hospital for 10 minutes. And then we should be in the air.
Wow.
So we make it really fast there, and the helicopter goes about 130 miles an hour. And we go in a straight line, of course. We don't have to stop at red lights or anything like that. So we will get that patient to the receiving hospital quickly, and then we walk straight to the cath lab, and usually they can expect to get off of our cot and onto the bed in the cath lab.
It's great to hear that from you because, we sit in meetings and we hear benchmarks and numbers and times that are met. And it's really true that if somebody walks into our hospital, oftentimes we can get them into the cath lab quicker than if they went into the ER of the hospital that has a cath lab. Would you, just your experience, that's probably accurate? Especially since you live in our hospital, and you're there. So it's not like a matter of waiting and that kind of stuff.
Right. Yeah. A patient that comes into either Florence or Gilbert, we're right upstairs. As soon as they know that they're going to send that patient out, they contact us, and we gather some equipment and come downstairs and get you and be back in the helicopter in 10 minutes.
Wow, that's huge for people listening, especially in the local area. Gilbert ER Hospital is really great at doing that. I mean, the track record is good. I know Sandy, you've been very instrumental in helping to maintain that, and so it's great to hear that from you guys. What other marketing kind of ideas do you talk about when you're marketing something like LifeNet? What are the things that you talk about?
Well, I talk about the education that we can provide as a company, Air Methods. And so a lot of people don't understand that we offer some of the critical training classes that the flight crews are certified in, and we offer that to the hospitals, because sometimes some of these hospitals, it's very expensive to train their hospital staff. So by us offering that as a partnership with the community, we can help save that hospital money by providing that education.
That's
but the other
huge.
thing that it does is it builds a rapport with the flight crew and the community that's out there. So then when they, later on down the road, they come across a patient, they're working together, they already know the flight crew because they've already built that rapport with that outreach education that we offer.
Wow.
And that provides seamless transition of patient care. And so it's better for the flight crew, it's better for the community, and most importantly, it's better for the patient.
There's not a whole lot of room for error, is what I'm sensing. I mean, obviously in the hospital, we try to stay as streamlined as possible in the ICU and managing patients, but in the air, I would think it's even more stringent. And so that's a great question.
Ricky from Phoenix says, do you still transport a patient if they have no insurance? And what is the approximate cost of a helicopter transfer to a hospital for someone uninsured?
When we are called to transport a hospital or transport a patient to another hospital, we, as a flight crew, know absolutely nothing about their insurance status.
I think they, and maybe they asked it wrong, but I think what they mean is from a scene.
Or from a hospital scene, same thing. We have as a flight crew, we have no idea what their insurance status is. We will never turn down a patient because of their insurance status. As for the cost, it differs depending on mileage, what we're having to do. I really can't give an exact number on that.
flying a patient is expensive, but there are a lot of factors that come into play when somebody, is transferred, how that's reimbursed. There's some state programs that are out there. So each case is unique. And so we try to work with not only the hospitals, the insurance providers, but also with the state and being able to cover that cost for that patient.
So it's at the local level, it's at the state level, which I think is really where it should be. I mean, that's great. But I think you said something that we all as healthcare providers live up to day in and day out, and that is we take care of the patient, and really we don't know what the insurance status is. We're not going to turn down a patient, and that's really important for listeners to know. You end up showing up on a scene. You're not going to ask for insurance and not transport them to safety based on insurance. That doesn't happen.
Right. As a flight crew, we never ask insurance status.
Right. I think that's huge, and that's good. Any other questions, Joe? Anything
No,
else?
but it's nice to squash those crazy rumors.
Yeah. I know that healthcare needs. There's some things that need to be fixed in it, but I don't think it's as broken as people think it is. We don't turn people down. Would you agree with that? Yeah.
Yeah, definitely. And we're there to do the best job that we're trained to do. We do this job because we absolutely love it.
Right.
And I don't think anyone in this field would treat anybody different depending on their insurance status.
And I believe in both hospitals, it even says it on the wall when you walk in.
Right. That's true. I mean, that's absolutely true. Anything else? I want to kind of hear a little bit more of personal experience kind of stuff. Anything else that you can think of that comes to mind just in doing what you do, just to share with the listeners and give us a sense of really what your day is filled with. Any other particular patient encounters that you want to share? If you want to think about it.
Yeah. Just kind of in general, we take care of pretty sick patients every day. And most of our flights, the patients are receiving different medications through pumps. They could be on ventilators. But above that, every once in a while, we get those patients that are so sick and really hard to stabilize. And I think that's one of my favorite things to do, is take care of those patients that you have to start new medications on and kind of change what's going on a little bit. We, as a team, can intubate a conscious patient. We can give the medications to kind of put them to sleep, just like surgery, and intubate and put them on a ventilator. And that's one of the really cool things that I think we get to do that not very many other paramedics, and I don't think hardly any other nurses get to do.
Right. So you're right in it, managing that patient in real time. Do you have a pharmacy on the flight? I mean, I would think that you would have, all the medications that you need, but it sounds like it's pretty stocked. It would have to be stocked.
Yes, we carry several different medications that we can use. Pretty much, at least one type of medication for everything.
Really? Okay. Yeah. That's good. I mean, you're not going to need to manage long-term antibiotics and those kinds of things, but it's more ICU pressors, making sure that blood pressures are controlled. Sedation kind of things, those kinds of medications.
Correct.
Yeah, and we're even trained to take a patient on an aortic balloon pump. We can take somebody that's that sick in the helicopter. So, or if we get a big enough helicopter, we can take a patient that's on ECMO or a heart-lung machine in the helicopter if they need to go somewhere for specialized care.
Wow. That brings up a question. Do you ever, are you ever part of transporting organs? For example, like if they're going to harvest an organ, like a heart or a lung or a kidney or something, and oftentimes they need to get it to another location quickly. Do you ever do that? Do you ever just transport an organ that way?
Our company does not do that I'm aware of. Maybe different, but there are, I'm sure the programs that manage that. They use aircraft, they use fixed wings.
Right.
I'm not sure if they use helicopters, but there are specific programs that just deal with that
Exactly.
issue.
Right, and I didn't know if that was something that you guys did or not. Okay. Do you, are you certified in talking about organ transplant, organ donation, not transplant, but donors? For example, I understand that you have to be certified in order to really approach a patient or a patient's family in terms of being an organ donor and harvesting that organ. Is that something in your jurisdiction or not?
When I worked in the hospitals, I was able to do that. But in this line of work, we're just trying to do the best that we can. We're with the patient for
it's probably
such a
not
short amount of time.
Right.
And we really don't get too much contact with the families and stuff like that. So that's kind of left up to either the sending or the receiving facility.
Okay, that's good.
And this being a flight paramedic for me has been kind of a change because working on the ground, sometimes you get to a situation where you realize there's nothing else you can do to help somebody. But as a flight crew, we do absolutely everything that we can, and we keep working until we get that person to a doctor that can make that decision. And so we're going a lot further than some other people would get.
Right. That's a good point. Joe, another question.
One of our chatters says, so like firefighters, you must have some downtime. Who's the chef?
We take turns.
Do you guys have a gym up there? Do you work out or anything like that?
We don't have a gym at this facility, no.
Okay.
We have a kitchen with an indoor George Foreman grill. So
well, you're welcome to come work out right down the steps and across the parking lot if you want.
And then we have Teresa Hopkins from Tempe, Arizona. A question that goes out to the RN and paramedic. Is there an experience that stands out to you in your career that was incredible or amazing where you saved a life or lives?
Every flight. You get on scene or you take a patient out of a hospital and it's all the critical care thinking that you're doing and talking to your partner, and every flight is very memorable.
Yeah, I think I'm just thinking if I were asked that question, it would be really hard to identify a specific case.
Correct.
Because we're so intense, in the moment of what we're doing, and then, once you package that patient up, bring them to the ER, then you're on to the next case. And so I can understand how, you're with them for just a short period of time, as opposed to maybe an ICU nurse that spends ongoing days, even weeks with patients and families. That can become a little bit more memorable and kind of intimate, if you will. But I think with what you guys do, it's more of a snapshot. Do your job, save a life, and move on to the next one. Would that be accurate?
That is, yeah. And every flight is different. You could get called for a motor vehicle accident, and then right after that be called for another motor vehicle accident, and they're so different every time.
Do you see, and this is just a question, do you see, how do I want to say this? The motorcycles, in my mind, are very dangerous. And I know there's a lot of listeners that, but I see people riding with no helmets. Is there anything that you want to kind of shout out to the listeners that would, maybe some safety tips, just from your experience of what you see? Seat belts. Does that really save lives? Is it something that we really should do, or is it blown out of proportion?
Yeah, I think seatbelts definitely do save people's lives. Just think about the risks of how much force is going around if you're in a motor vehicle that does maybe roll or is in a high impact collision. How much more dangerous it's going to be thrown out of that vehicle than to stay in your seat. I think they make a world of difference.
Okay. And then always make sure that your kids are belted in appropriately in the appropriate car seat. And if you have any questions about your car seat, whether it's in properly or not, you can always go to your local police station and they can help you out.
That's a huge topic. There were some studies out that I just saw, and I haven't really gone through, but they're talking about our car seats, the safety, really safe. I mean, we really need to scrutinize that and make sure that our kids are safely secured in the seat, because sometimes they may not be, they may not fit right or...
Right, so not just in the car seat, but they need to be secured properly in the car seat.
Right. Okay, that's good. We're going to talk to Sandy here in a little bit. Today's Halloween, and we're going to get some tips and so forth about safety for our kids that are going trick or treating and those kinds of things. Coming from an ER perspective. So, Sandy, we'll get you kind of plugged back in here. Is there anything you want to kind of tell us in terms of some tips, just for the general public? Specifically for a day like today, Halloween, kids going out, what would your message be?
Well, I think first of all, that for our motorists, please remember that these are kids, and they're excited, and they're going to be running, perhaps not in the crosswalk, perhaps not on the corner. They'll dart through between cars, run out of driveways. They're excited. Those little ghosts and goblins out there, they want that candy.
Right.
So I think motorists really have to kind of keep that peripheral vision going too, because it's very important to be able to see them. And which kind of brings us into the type of costume. I mean, parents, you really need to be careful. You want to make sure that they're visible. I mean, you know, there's so many neat costumes out there, and some of them I've seen are like really dark. And put reflective taping on them. Have the kids carry either those little glow sticks or flashlights so they can be seen too. So important, because, like I said, everybody's running around, and I know on some streets I've driven down on Halloween. It's kind of like, park the car, just walk. You can't get through.
You can't get through, and that's probably safest.
Exactly.
What about the candy? You know, any problems with tainting, or, you know, is there anything to be concerned about?
You know,
with
I
that?
think we've been pretty lucky for several years now. I haven't heard of too much, you know, candy that's been really tainted, but it's always best for the parents to remind the kids, bring it home. Let us look at it first. Let us make sure that it's something that's recognizable. And that's also really, if you are participating in trick or treat and you are, you know, you're waiting for those little ghosts, goblins, and critters to knock on your door, it's always good to have something that is recognizable. I know a lot of people like to give out cupcakes or, you know, popcorn balls or something like that, but sometimes, you know, people are a little bit wary of that. While home-baked goods are really cool, for kids, if the parents don't know who you are, that could be a concern for them.
Absolutely. And I think those are just, you know, just general topics, just general tips to keep in mind, just for safety. I mean, and I think that lends to really what this show is all about. It's really an outreach to the community to just bring some education, open up a conversation, and really make us available to people calling in to answer questions. And I think that lends to really what Gilbert Hospital and Florence Hospital at Anthem is really about. You know, we're committed to the community. We're committed to health and well-being, and I think that's important.
It's good to remember, you know, if your little ghosts and goblins do eat way too much candy and really do get sick, we're there. We're there 24/7.
Exactly.
Here's a good question from Becca in Mesa. Does your hospital x-ray goodies, or is that an old wives' tale?
That has been done in the past, but because they've never really found anything. So it's kind of, I mean, I'm sure if people were really, really concerned and they brought something, we would be happy to look at it. But the x-ray thing has pretty much gone by the wayside, I think.
Right. I mean, if you suspect anything,
throw it away.
Yeah, throw it away, or don't hesitate, you know, to coming in. I know there were some apples and fruits, and, you know, sometimes there's some suspicion of people can, you know, stick things in there. If you have a suspicion, don't even consider it. Just, you know, just get rid of it. I guess in the past they used to X-ray them, but I've not really in my time at the hospital, you know, have seen that. I don't know that that's really in vogue these days.
I remember we used to do it many years ago, but haven't done it in recent years.
Right.
Yeah.
Right.
But I think too, Dr. Borik, another thing to think about too is with these, is with your little trick-or-treaters, is make sure you tell them that. Go to a home that's well lit, that has the lights on, and it's probably always good to stay in your neighborhood because you usually know those people. And while we hate to think about it, there are people out there that perhaps don't care about others as much as we do.
Right.
So we really want to, you know, if you are going to be giving out candy, have your porch light on. Make sure that your walkway is well lit. Move things out of the way that these little kids might trip over or fall over.
Right.
So just, you know, keep the general area as safe as possible.
Animals as well. You have to be careful, you know, of dogs and those kinds of things, because on occasion you'll see somebody that's attacked by a dog if you come too close.
Too close, yeah. Keep pets away.
Yeah, you know, that brings me to thinking about, we were talking about the helicopter and animals, and next week, you know, next week we're going to have a veterinarian on the show. But I want to just ask you, there's some myths that we've been talking about in really promoting the hospital, Gilbert ER, and, you know, one person said, well, you know, we want to make sure people know that we're a full-fledged acute care hospital. You know, we're not a veterinary hospital, you know, those kinds of things. My question to you, is there a company that treats animals the way that, you know, for example, like a Life Medic that transports animals. Do they do that? Is that something that's in existence or not?
I haven't heard too much about it. Maybe you know more about it than I do.
I know in Metropolitan Phoenix, in the downtown area, they do have a doggy ambulance.
An air ambulance service?
Not an air ambulance, but a doggy ambulance by ground. Yeah.
Okay.
And I have seen it, so I know it's there.
That's good, but not an air ambulance.
No, not an air.
Okay.
Not that we know of.
When I worked Ground 911, I had worked in Oklahoma for years, and they trained our company to be able to treat the police dogs.
Oh, that's
neat.
And
so we could treat and transport them, and we could do everything from managing wounds to giving narcotics to whatever the little puppy needed to get to the emergency vet clinic. So
you've actually started an IV on a dog?
I have only bandaged.
Okay.
I haven't had to go any further than that, luckily.
Wow, that's neat. It's a whole different, mentality, I would think. But ministering to infants, I think, would be similar. It's a totally different anatomy, I would think, to a certain extent. Maybe not completely different, but dealing with an adult, I think, is so different than dealing. Do you have experience or preference, or what is your? I mean, you can't have preference, but in your background and training with peds.
Yeah, we kind of take whatever we get.
Obviously,
and I do enjoy working with pediatric patients.
You do.
I think that they are a little bit more challenging. The assessment's hard because they can't tell you what hurts. They might be terrified of you. But my experience is if you get one that's fairly sick, you can kind of get them better pretty quickly. With just basic things, oxygen, fluid, whatever they kind of need to come back around the corner. Right. And as a provider, it's great to get somebody better. That's what it's all about.
So your background as paramedic and RN is really, has to be both in adult medicine and pediatric medicine.
Yes, correct.
Wow. For me, pediatrics is just such a foreign, it would be like, taking care of an animal, because I don't take care of pediatric kids. So, my hat's off to you. That's great. That's good to know. I think it gives comfort to the community knowing that there's people trained like you guys there. And that's neat. I think we have a question. And do you believe we're almost out of time? This hour really, really flew by, didn't it?
Yeah.
Roy from Manhattan, and he's a commercial pilot for Southwest.
Wow.
He said there's an air ambulance for animals in the Hamptons.
Oh.
Nice. Well, thanks for calling. That answers.
Some good information there
Yeah.
if you're going on a trip.
Huh. That's good. That's very, very good. Anything else? We're gonna wrap things up here. Again, we have a few more minutes if anybody wants to call in, 745-1033. Anything else you want to share with us, just in terms of doing what you do, talking to your colleagues? Anything you want to share as we wrap this up?
I think it's one of the important things to remember about air medicine and this pre-hospital or transport medicine is we're all working together. We're working with the hospital, we're working with fire departments, paramedics. We're all one big team doing our best to get somebody who needs emergent care to the right facility. And that's everything from continuing education with the pre-hospital providers, with the hospital. We do drills with the hospital. We do drills with EMS. I've been involved before in the airport drills.
Oh, wow.
Where they come in and they do this mass drill. And so a lot of training goes into this, and we're here to take care of people, and we love our job.
Right. Now, normally, who would call on an air ambulance? It would be the ground crew. Is that right?
Right.
Okay.
Yes.
Okay.
Both the law enforcement can, paramedics can, fire department can.
Hospitals.
Yep.
Okay, that's good. Sandy, did you want to kind of wrap up? Anything else you want to share with us, just from your standpoint as it pertains to the hospitals?
I think it's important to know that we are an acute care general hospital. Both of our hospitals, we have highly trained people at both facilities. We are lucky enough to have a helicopter on both of our roofs, and we do. I want to stress too that we do work as a team. Our times are amazing, from getting the patient, the walk-in patient, into the door, into the helicopter, to, for instance, the cath lab. We at Gilbert, we strive to have it done from our door to the time they lift off, not just to lift off in 29 minutes. That's our goal, and we do a good job because we train with the people, and we have such a good relationship.
Mm-hmm. That's huge. Mm-hmm. That's really, really huge. Joe, do you have any questions? Anything else that comes to mind?
Yeah, what level do you fly at? I mean, do people that have ear problems have any issues? You're not flying above the level where you have to be concerned about that, right?
Well, we wear hearing protection, and we also give our patients, or if we have ride-alongs, everybody has hearing protection. We fly above 500 feet. It just kind of depends on your base, what your max altitude will be.
But you're keeping pretty low, the lowest point that you can.
Correct. Yeah.
Yeah, and we work with our pilots. They're very flexible. They're very experienced. So if we have somebody, say for example, like somebody with a diving accident that gets the bends or something, you can't take those patients up very high because it'll make their condition a lot worse.
Right.
And so we'll communicate with the pilots and say, hey, can you fly us at the lowest safe altitude? And that's usually about 500 feet. But we also go over the mountains. When we go to places like San Carlos or down into Tucson, we have to get up to 7,000 feet.
Wow.
So,
are there any medical restrictions to be a flight crew nurse or medic? You know what I mean? Or is it more stringent in terms of, your condition, like, for example, no history of high blood pressure or any other medical conditions? Like a pilot, for example. I understand that pilots that are, FAA approved, their medical history has to be pretty stringent and flawless, I guess.
Yeah, I'm not too sure what the pilots. I know that theirs is a lot stricter than ours, just because they're actually operating the aircraft.
The aircraft, right? Mm-hmm, mm-hmm.
But for us, we have to be able to lift a certain amount of weight. Mm-hmm. We have to have good eyesight, good hearing.
Yeah, they do test our hearing every year to make sure that we're staying up there and we're using hearing protection. The other thing, I think it's good if you're going to be in this field to stay pretty physically fit, because it's a demanding job, not just physically, but sometimes you're up long hours and working pretty hard. And then also, if you keep your personal weight under control, then we can transport heavier patients, because there's a maximum for what the helicopter can lift.
So is that a hiring restriction? Or, I guess you can't, and I don't know, maybe this is something that we can look up on the website, but it's just something interesting to think about. As people are out there listening and thinking about maybe this as their next profession, if you will.
Yeah.
Yeah, that's good.
Is there a lot of personal stress involved each flight that you go to take, or would you say it's more on the adrenaline side? I mean, I know you said adrenaline, but I imagine there's a fair amount of stress that comes along with this job.
There are a lot of stressors, and Air Methods does do a lot to help us alleviate a lot of that. You have stressors from anywhere from the vibration of the aircraft to just, drinking caffeine that day could be a stressor, bringing your personal life to work, and then just all the way down to the actual patient and, the stress of taking care of somebody that's so critically ill.
So does Air Methods put in place, different modalities, classes, relaxation classes, or those stress management kinds of things? Do they do that?
Every year we have to do a specific class on stress management.
Oh, really?
Yes.
Oh, that's interesting. We should implement that in the hospital.
Well, I already like our relaxation time when we get those.
And I'm part of leading that. But that's interesting. When you say stress management, I just want to take the last couple minutes and kind of open that up a little bit. So is it what does that entail? What is the stress management class that is required entail? Is it like biofeedback? I mean, what do you do?
It's usually a computerized class, and just bringing attention to us, just reminding us what all of the stressors that could be in our job, and helping us deal with it.
Yeah. And there's definitely things you can control and things you can't control, of course. So we try to minimize the things that we can control, and the other ones we have set things that we can do to talk about them, or different resources to kind of get us to cope with them if we do have some big call that is hard to deal with.
Right. So phase one probably would be identifying it, and then maybe taking it to the next level, which would be implementing some modalities to really how to deal with it. How to adjust the physiology of how we deal with stress, breathing exercises. Those kinds of things might be helpful.
That, and we've also gotten together if we have gone on a very stressful call with pre-hospital, fire departments, ambulance companies. We all kind of get together into a little meeting and talk about it.
Is there any spiritual care that is available for patients, crew, dealing, because you're dealing with life and death, and and we're trained to minister not only to the physical, emotional, spiritual. Is that something that's part of it, or is it too small or short of a window that you're with that patient?
We do,
like chaplains and that kind of thing.
We try and get, a lot of that happens with inter-facility transports where family members are there and they want to say a little prayer beforehand, and we try to respect that. But on the other hand, we want to try and get that patient in and out as quick as we can.
Right.
But we do the best that we can to work with everybody and the specific situation on, what the family
like somebody
needs.
from the Catholic faith would want to, maybe come and do an anointing or something like that. But time-wise, I would think for you would be critical to get that patient moving.
Right.
So it's a matter of juggling that. Yeah, there's a lot that goes into this. I mean, this is really a huge, piece of the puzzle that we deal with in terms of taking care of patients. Another question, Joe.
We've got someone on the chat that would like to know, as far as technology goes, is there anything you're looking forward to or know about that's coming in the future that is going to assist in your jobs or your field?
Man, the field of medicine is just always changing. And I think both of us are pretty passionate about these critical care level treatments that we have. And one of the things that I see coming that's pretty exciting is these heart and lung machines that are getting smaller, more compact. We can actually transport them a lot easier.
Wow.
And then patients with these balloon pumps in their heart, if they're in heart failure, this pump can really help alleviate some of that heart problems. And we're keeping patients going a lot better and having much better outcomes, transporting them on these balloon pumps to a facility that can do bypass or can put in a ventricular assist device that helps pump blood through their body. So I think it's great to be on the cutting edge, and that's what I feel like we're really doing.
So things are getting smaller, more compact, which is going to be compatible to doing what you do, which in the long run will impact probably mortality. Right, in a positive way. One question that last question prompted in my mind was preparing the aircraft, cleaning it, and getting it ready for the next. What measures are taken for that? I would guess that there's a cleaning crew that comes in, and or is it you guys that do that?
It's between us and our mechanic.
Okay, and that's it, right?
Yep, that's it. We, we work together to keep the aircraft in very good working order and clean. After every patient, we clean the aircraft, clean all of our equipment, everything like that.
I would think, in response to that last question, there's some new things on the horizon coming up where there's a UV handheld wand that they're actually talking about where, in a room, for example, in an OR room or a hospital room, where they can actually, use this device to eradicate any little pathogens or organisms that are left over after the cleaning to really minimize hospital-acquired infection. And I would think that would be, a perfect thing to have for the aircraft to just make sure that, that infection is rid from that small closed-in space.
Right. Yeah, that would be a good deal. And a lot of our equipment is disposable, and so we don't really have to clean too terribly much of it, especially when we're getting a patient that is in the field. They're not anywhere near sterile. They usually have gotten quite a bit of dirt or glass or whatever from a car accident, but we're really careful to go through the helicopter and get all that cleaned up for the next person.
Right, right. And if you have a known TB patient, for example, that you're transporting, obviously those universal precautions are taken.
Yes.
Yep.
Yeah, that's good. I want to we have 1 minute left. I want to see if we can get Kyle just to give us some closing comments, and then we'll wrap this up. I think this has been a great thing. You guys, thank you so much for taking time to come out and talk to us.
Thank you for having us.
Yeah, this has been good. Kyle, do you have anything you want to close? We have like 1 minute left, just to kind of wrap this thing up and share anything else that may be on your mind that we've been talking about.
Well, first of all, I just want to thank you guys for having us on the program so that we can do this outreach to the community to let them know what it is that we do and the services that we do provide. If people are still interested and they want to know more about the membership program, the Omni Advantage program that we offer, please go to our website, take a look at it, fill out an application. If you have any questions, there's a 1-800 number that you can call to see how you and your insurance,
Right. What is the website? Is it LifeNet or what is the? Do you know the website offhand or?
It's airmethods.com.
Airmethods.com.
Yeah.
Okay.
And then there's Omni Advantage, and I believe that's on there too. That you can go and there's a link to be able to get that information.
Okay, that's great to know. Joe, that's it. We're right at 2:00. This has been really enlightening for me. Just a neat opportunity to have you guys here and ask questions. So thank you again for being here.
Thank you.
Thanks, Joe. That's it. Next week we'll be here with, we have some great shows up and coming. Check out, if you're not on Facebook, go to facebook.com, friend us, like us, or DocTalkRadio.com. You can see some of the excerpts of all of our different shows and so forth. We'll see you next week. This concludes Doc Talk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
Doc Talk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.
Are you